Hello out there in television land. Welcome to another version of It's Your Health with a little bit of estrogen thrown in here for good measure. Philip Benyo with his bride, bringing you the latest and greatest in healthcare information. Make sure you check with your healthcare provider before doing any of the things that we talk about here on It's Your Health. The fastest 30 minutes in HD television, brought to you by Samsung Production. We'll be right back after this brief commercial message. Remember, you're watching It's Your Health, your leader in healthcare information. Welcome to the first segment of It's Your Health. Long time since we've been here. Mild winter, which I'll take. I'm voting for El Nino for president, so I'll take that for the next 8 years. What's new there,
That's probably your best choice.
What's new here, sweetheart?
Well, I just had a birthday.
Oh, you're kidding. When was that?
It was just recently.
I knew I forgot something.
Well, for my birthday, he sent me on a trip to California to visit my relatives.
That was what we call win-win.
Yes, except it was a present for him to get me to go to California. But that was a wonderful trip. I had a great time.
Glad you're back safely.
You got out of having to find me a birthday present, too.
Working on next year.
Let's talk about not things that are going on in California, but things that we're experiencing right now. And this is the time where we're going to get allergies.
Up the wazoo, I'm telling you, we have seen seasonal allergies like never before, probably because of that mild winter. And it's characterized by kind of a runny nose with some clear stuff, maybe some itchiness, watery eyes, and we've really seen a number of allergies. And I think we live in an allergy belt, as evidenced by your map.
Yes, it's, some parts are worse than other parts. Carbon County doesn't look quite as bad as some of the other counties. But you want to look for an antihistamine, right? Or a decongestant.
Well, I like non-sedating antihistamines. Decongestants are a little bit of a problem, especially in the elderly. It can affect vision, glaucoma.
And you shouldn't drive.
And you shouldn't drive. And things like holding on to your urine can be an issue. So I think the other issue is you might want to consider some saline nasal spray or some sinus washes. And if push comes to shove, we use cortisone nasal sprays. They're very effective. And for those really resistant cases, I like Singulair, very safe drug you take every day that modifies and tones down the allergies no matter what it's from. Even if it's from your cat or your wife or whatever, it works.
But if a person has allergies, does he need to go to the doctor?
Only if it's causing symptoms, because the allergies, if you're a bacteria, they like those nasal secretions. So the next thing is they're going to go in and create a sinusitis or a bacterial infection, which would be bad.
Oh, okay. Well, let's go to something good.
Okay.
Fruit every day might help your heart, and we have heard this over and over again. You're not buying me enough fruit. Eating fresh fruit regularly may help prevent heart attack and strokes. Adults who ate fresh fruit, such as apples and oranges, every day had a 1/3 reduced risk of dying from heart attack or stroke.
You know, it's interesting. If you come in our office, I have a plaque that someone knitted for me 20 years ago, 25 years ago, when her last name wasn't Benyo, saying an apple a day keeps the doctor away. And that's still true today, right?
Oh, more than 25 years ago.
Was it?
I think so. I think you've known me for a very long time.
It feels longer, you're right. Okay.
Never mind.
Moving right along.
Psoriasis and your diet. If you're concerned about your psoriasis and you're thinking about a psoriasis diet, Your doctor will tell you to cut out the junk food and the alcohol, and that most of the diets don't work and are just a waste of your money and your time.
Yeah, it's sort of a fad. I think we're looking for a cure through another venue, and it's important that you do lay off alcohol and the junk food. However, I hate to see people suffer needlessly. There are some great remedies out there, some really disease-modifying agents for psoriasis, and so you really should look into seeing a dermatologist, a specialist in that area, that can put you on a path towards health and getting to really tone down the psoriasis.
What does psoriasis look like?
Well, it's a raised, red, itchy, patchy plaque, and it's usually on the extensor surfaces of the joints.
Do you get it on your face?
Well, there are certain forms. There's various forms that can affect the joints, for example, various forms of psoriatic arthritis. It can affect some areas of the skin than just the traditional ones. But it's important that you really, first of all, get a proper diagnosis, because not every red, raised, itchy thing is psoriasis, and get proper treatment.
Sounds like a good idea.
I'm full of them.
You're full of it, all right.
Okay.
Let's talk about a problem that too many people have. When a neck goes bad, I mean, that causes such severe pain, not only in your neck, your back, your shoulders. You really suffer from that. What are the things that cause neck pain?
Well, in the olden days when I started out, we would see neck pain after a motor vehicle accident, like a whiplash. But today we're seeing tech neck, because everybody's bent in front of a computer and it's putting pressure on the nerves, and you're getting degenerative changes and spasms. Get a look at this picture of what the normal anatomy is of your neck. You can see the bones and the discs and the nerves coming out in front of that. And then if we view down to the issues of where the nerve now gets pinched, that's going to cause pain in that area, spasm of the neck muscles, and sometimes going down your arms as well. So tech neck is really out there. You don't necessarily have to have a big injury for it. And since we can't get rid of technology, you may need to do some neck exercises, perhaps some chiropractic care, physical therapy, range of motion. Meds are not the answer, by the way, so don't look for that.
Okay. And also the height of your computer screen. If you have your computer screen down here, you're going to be bending your neck all the time if you try to make it more stable to where you are. But the computer desks that they make are made for you to be looking down at the screen. And that doesn't help the situation at all.
It doesn't help. And of course, we've become more of a sedentary society today, which is not helping anything.
Now, did you want to talk about this disgusting thing before we take our break?
Very briefly, I thought this was very interesting. On the first picture here, there is an ear which has been bitten off by a pit bull. And there's proof of it, because there's the ear with the earring in it. And then they put a leech inside the ear.
A live leech.
A live leech to help with the circulation and the healing process. And then they reattached that ear, which looks practically...
It looks as good as new.
As good as new.
Is the leech still there?
The leech is gone, and the pit bull's probably gone too, so...
Wow, that's amazing. Do they use leeches for other things?
Occasionally they use them in plastic surgery, and it's a kind of a surgical thing. And I'm not really up or into leeches, but...
And on that note, I think we should take a break.
We will take a break.
Enough talk about leeches for right now.
We'll be right back after this brief commercial message. Remember, you're watching It's Your Health, your leader in healthcare information. We'll be right back. Welcome back to the second segment of It's Your Health. I told you it's the fastest half hour in television history. I'm here with my bride, and we're going over New trends in healthcare, right?
Well, we do our best to do research that is very current to give you the latest that we can find. And we just finished talking about leeches, and now we're going to talk about something very serious and something more and more people are dealing with, and that's Alzheimer's care. And here are 6 tips to improve daily life. The first one is to keep a routine.
That's true. When patients with Alzheimer's diseases have a change in their environment or a change in their otherwise normal routine, they kind of get off balance and don't cope with it very well. So that's important.
Limit the amount of sound and movement.
Again, you'll notice that when a patient who gets sick and comes into the hospital who has Alzheimer's, they will go into a delirious process and become unglued and get worse, have behavioral disturbances, difficulty concentrating. Again, that's because we change their environment, and hospitals can be a little noisy and sleep disruptive.
And also, when you're meeting as a family in groups, you should choose small groups, not have the whole family there at one time. And when they are there, turn off the television, because that's a distraction.
Yeah, I hate that. That's a good point.
The next one is find things they can do.
Well, of course, now is not the time to start a new task. And so things that they've done in the past, for example, word searches, crossword puzzles, things that kind of are interesting and may help her mind.
You know, they can set the table. Maybe it's not going to be exactly set the way you want it. They may not be able to wash clothes anymore, but they may be able to fold the clothes. So you can keep them involved that way. The next one is be understanding.
That's the toughest, because the person with Alzheimer's is not the person you knew before. Not only do you have memory issues, you have tremendous behavioral and personality issues. And so this person who's now there is someone who you may not like.
You know, and on a small thing, I know what I hate is when somebody drinks out of the milk container. That really drives me crazy.
It's horrible.
And if you have an Alzheimer patient who does that, get them their own quart of milk and in big letters put their name on it so that they can drink out of it.
Is that what that's doing in the refrigerator with my name on it?
Yeah, with your name on it.
Okay.
Drink this. The next one is to make decisions for your loved ones.
And that's very difficult to do because they want to maintain their independence. But it's very important that people plan ahead, have a power of attorney, and you may actually want to get a legal opinion to make sure that the loved one who has Alzheimer's doesn't have any assets. They should be someone who you need to plan for a end-of-life decision-making process. And since the person who has Alzheimer's can't, they are going to rely on someone that can, and that's you, the loved one. So you got to do that early, do it ahead of time. Don't wait until something hits the fan. Do it early.
And on a much smaller scale, don't give them a lot of choices like, what do you want to wear today? Pick out 2 shirts or 2 blouses and say, which one would you like to wear? Make it easy for them. And finally, our last one, be ready for sundowning.
Yeah, that's a big problem. When the sun goes down, things kind of get out of hand. Increased confusional states, wandering, falls, injuries along those lines. And we see that manifested and really magnified when you go into the hospital. Sundowning is a big problem. And families sometimes have issues with, well, he was fine when he came in the hospital. But again, it's a big problem. So,
well, one of the things you can do is turn on more lights. Mm-hmm. Another thing you can do is let the patient know that they're in a safe place, even if they want to follow you around the house while you lock the doors. Whatever it takes to help reduce that sundowning.
Good points for a big and increasingly big problem.
Speaking of problems, creepy crawlies is our topic.
Ah.
And this is about creepy crawlies you find in buffets.
Yeah, I was never a big buffet man, although it's nice to stop, and since I do the cooking, I like to get some cooking relief. So I go to a buffet and pick up some food and take it home.
Don't think it's because he's this wonderful man who wants to cook. He cooks specifically so he doesn't have to eat my cooking.
There you go.
There you go. That's the reason.
All right, let's talk about dangers of buffets.
Well, first of all, if you're somebody making the food, wash your hands, no excuses. And what we're dealing with is a norovirus, and it comes from dirty hands. That's the first one. The second one is E. coli.
Big problem. These things are going to cause nausea, vomiting, and diarrhea.
And that comes from undercooked meat and raw vegetables. Listeria.
Another bad bug that can be seen in buffets.
Avoid hot dogs, deli meats, and cheeses. And we're not talking about everywhere. We're just talking about places that aren't doing the job that they should be doing. Hepatitis, which is hepatitis A, you get the same kind of symptoms, and it's because you're eating fecal material. That's enough said on that.
Yuck.
Number 5 is salmonella, undercooked meat, fish, and eggs, and you will definitely feel those symptoms for 12 up to 72 hours. You will really be sick.
Ptomaine poisoning.
And if you come down with any of them, drink plenty of liquids. And remember, when you go to a buffet, hot foods should be hot. Cold foods should be cold. Check the freshness and make sure they have a sneeze guard.
Ah, I didn't think of that. Yeah.
Yes, absolutely. So there's lots of ways for you to be safe and enjoy a buffet.
Well,
So you could take me to a buffet.
yeah, I guess I could.
We could have a buffet at home.
Moving right along.
Oh, okay. Cancer Health Center tells us that marriage may be a cancer fighter.
So you mean my wedding band is actually helping to prevent cancer? Is that what you're
A
telling me?
wedding band may be powerful medicine against cancer. Married people have a marked survival advantage. Single men with cancer had a death rate 27% higher than for married males, and for women it was 19% higher. The emotional bonds of matrimony is the reason that, not because you have a financial advantage or because you have the money or you're living together, but because you have an emotional connection. And there we go, right into our break, knowing about an emotional connection.
We'll be right back.
We have an emotional connection.
We'll be right back after this brief commercial message. Remember, you're watching It's Your Health, your leader in healthcare information.
Welcome to the final segment of this edition of It's Your Health. And I was told by someone to stop talking so much, that we need to get serious and go through all of these items that we have to share with you. So I'm done talking.
You're done being
Not.
chatty? Okay, well, let's move right along. 'Cause
Okay. This one we've heard about 100 times, but we need to keep hearing about it because it's important. Berries, big health benefits in small packages. You know berries are good for you, but researchers are finding more and more reasons to eat these nutritious powerhouses. They help with erectile dysfunction, they can help with Alzheimer's, help with weight loss, cancer, heart disease, inflammation. You almost can name anything, and berries will do it. The darker, the better. Blueberries win. They're the number one. But don't just eat blueberries. Eat the whole fruit.
And nothing but the fruit. So
Yes.
help me God. No, there's flavonoids, a lot of good stuff. And now that we're getting into spring and summer, the berries and grapes should be plentiful and perhaps a little cheaper.
Yeah, it was very expensive during the winter, that's for sure. So we like fruit, and we like all kinds as long as we have the flavonoids to help us. And going back to how berries can help us, how they can help people with Alzheimer's, we just mentioned that. And how can you tell when Alzheimer's is mild, moderate, or severe?
Well, it goes down to behavioral disturbances, and it goes down to what we call self-care deficits, being able to take care of oneself, right?
Absolutely. It starts off with they get lost in thought, they forget what they're going to say. They get lost in familiar settings. That's the beginning of it. It then goes to forgetting things about their past. They can't do things that take several steps to do, and they become frustrated or angry, and that's certainly understandable. This is the time when we read about people wandering away from home and getting lost. And finally, if it's severe, you know it's severe. They can't feed themselves, they can't use the restroom, they can't get dressed by themselves. This is the time when you need to be ready to possibly put the patient in a better situation.
Right. Assisted living sometimes, and of course people will tend to graduate with their illness to skilled nursing facilities and nursing home placements because of these tremendous self-care deficits.
And eventually hospice.
Right. Good point.
A bad marriage burdens an aging heart.
Oh, that's why I'm getting chest pains. Okay.
A bad marriage increases I ignored that, an older adult's risk of heart trouble. And that's particularly true for women.
Oh, really?
Yes.
Oh, my.
Men who were overly critical or demanding, they help.
Why are you looking at me when you said that?
Their wives developed heart disease, and it increases with age. Women tend to internalize their negative feelings and tend not to express it as easily as men do.
Not her. Go ahead. I'm sorry. I don't want to interrupt.
Are you becoming chatty?
I'm becoming chatty. You're right.
Okay, so anyway, a bad marriage isn't good for you all the way around.
Yeah, I can agree with that.
You know, we're on HD now.
I heard. Oh, yeah.
I'll bet they can see that on HD.
Oh, well.
Okay, long-term PPI use tied to increased risk of dementia. I don't know what PPI is.
Okay, proton pump inhibitors are those medicines that we're all taking for reflux and heartburn, Prilosec, Protonix, Dexilant.
I take that.
Yes, and they're great drugs because they work, but they also have been becoming shown, they are becoming, what's happening with the long-term use of these is we're finding side effects of the medications. The proton pump inhibitors have been linked with early bone loss and fracture risk, and now it's been thought that this can actually be creating or advancing a dementing illness. And the point is these medicines shouldn't be taken unless you really need them long term. We use them as spot therapy for reflux symptoms, and unless you have a Barrett's esophagitis where there's actual tissue changes that could be precancerous, you should really limit the use of these medications and make sure you check with your healthcare provider because too much of a good thing is no good, like marriage.
I heard too much of a good thing is wonderful.
Oh, really? Okay. To be continued.
Influenza is linked to increased atrial fib risk afterward.
Well, we haven't seen a lot of flu. I mean, we've seen flu symptoms, but actual influenza cases have been down this year. But the point of this article is that people who have the flu, influenza itself, afterwards they can have skipped heartbeats, so-called atrial fibrillation. We're not sure exactly of the mechanism of action of this inflammation, but it is important because atrial fibrillation an irregular heartbeat can lead to a stroke risk. So that's important too. So if you have the flu, make sure you get checked.
Okay, and the next one, testosterone, moderate sexual and mood benefits. Testosterone therapy provides small to moderate benefits in sexual function and mood.
Well, years back, everybody was concerned about low T, the low testosterone. The guys out there are gaining weight, they're tired, they're weak, they're not in bed hitting home runs like they used to. And so we measured their testosterone levels and found they were low. And so everybody started supplementing patients who were low on testosterone with these jellies and jams and gels. And it turns out that we're not so sure how much it works. And the point of this article was that whatever effects you're going to see to the good are moderate. They're moderate, and they don't cure everything. So it's if you're having symptoms that you are attributing to low testosterone and you have a supplement, don't expect to be turned into someone who's 18 again.
Yeah.
Okay. Maybe 21.
Okay, let's get back to women's health. Underactive thyroid may raise type 2 diabetes risk. People with an underactive thyroid or hypothyroidism may be at greater risk for type 2 diabetes, even if their thyroid hormone levels are kept within normal range.
Well, thyroid conditions are they're underdiagnosed and sometimes undertreated. And there may be about 1 out of 10 people out there have a thyroid condition. It does run in families, particularly in our area. And it can lead to increased cholesterol, tired, weakness, fatigue, weight gain, which may be part of this diabetic issue, although it's probably more complicated than that.
Well, the hypothyroidism is tied to reduced insulin sensitivity.
Right.
So there you have a connection.
The so-called insulin resistance. But I think it's important out there that when you get your physical exam, have your thyroid checked. It's a simple blood test, and as I said, you'd be surprised. We see more and more patients who have gone through various doctors, physicians, whatever, they show up here and their thyroid's low. So don't be one of them.
Okay, but be one of them that watches this show regularly.
Oh, I like that. That was a good
segue.
I like that.
Thank you very much.
Thank you for watching It's Your Health and allowing us to inform and entertain you, hopefully. Remember, you're watching It's Your Health, your healthcare leader on Samsung Productions in HD, right?
Yes, and don't be too chatty.